Good morning, everybody. Amanda from Little Lotus Yoga, and I'm really excited to have my friend Sarah here today, who is an amazing physiotherapist specialized in women's health and pelvic health as well. She is one of the physios at the amazing team of Bloom Health right here in Ottawa. And today specifically, we're diving into the conversation around cesarean births, our pelvic floor health, and recovering after cesarean birth and what that can look like. Before I hit go live, Sarah and I were just chatting about, there's a lot of misinformation that is out there on the wide world, web, internet, Google, which can be scary a lot of times when we start to Google things and we start to think about the worst case scenarios. And we really want to chat today about cesarean births and the amazing recovery process that you can have and how you can start moving in a way that feels really great for yourself and your body during the postpartum period. So thank you for being here, Sarah. Can you share with everyone a little bit about you?
Yeah, so thank you so much for having me. So as Amanda said, my name is Sarah Trottier. I'm a pelvic health physio. So for those who have no idea what that is, I am a registered physiotherapist. So I still treat people for knees, backs, ankles, all that kind of stuff. But here at Bloom, all the physiotherapists here, we also work with women and men for pelvic health. So I've been doing this for about, pelvic health specifically, for about 5 years. I've been a registered physiotherapist for 6 years. So that means I got into the pelvic health world early on in my career. And it just was a fluke. I worked at a clinic run by more males, and I was the only female physiotherapist there. And we had a lady come in for some back pain and some stress incontinence. So every time she would cough or sneeze, she would leak. And since I'm a female, they said, hey, you probably should see this client. And I was just like, I have no idea what to do, because in school, we don't really learn a whole lot. I remember just watching this video, and it was one class, not even a course, one class. And the physio came in and she showed us this video of a CrossFitter lifting weight and leaking and thinking that it was normal. So that's all I knew about pelvic floor. So I reached out, I did some research, I took some courses, and I fell in love with pelvic health. And I wouldn't look back. I love what I do. I love helping women understand and all the changes that we go through, whether if it's menopause, pregnancy, postpartum. We're there for you. And it's just such a rewarding job to do. And things like this, chatting with you and talking about cesarean birth, which is an area that a lot of people don't know about in terms of pelvic health recovery. I just feel so privileged to be able to talk about this. And I know that it's information that people do need out there. So yeah, I thank you so much for having me.
Oh, thank you. And a huge congrats to you on your recent marriage.
Finally.
I'm sure it's been challenging during COVID and this pandemic, and finally married, newlywed. So congratulations on that.
Thank you.
Can you share with us, or share some information? I hear often from people saying, well, I had a cesarean birth, so there was no impact or challenges with my pelvic floor. Why would I go see a pelvic floor physiotherapist? So what would your response be to that?
Oh, wow. Yeah. So this is probably one of the most common myths. I call them myths because it's not in fact true, that pelvic health isn't something that women after cesarean birth need to do. And I think we're termed pelvic floor physios because it's a physio who looks at my pelvic floor. But we look at the whole body as a full. We don't just do pelvic floor assessments. So we look at the back, the hips, the breathing, your posture, your alignment. We look at everything that can have an impact on your pelvic floor. And then if you take even just pregnancy in its full, you're pregnant for 9 months. There are so many significant changes that occur to your body. Our abdominal wall has to stretch and expand to accommodate the growing baby. Our pelvic floor muscles have to work extra hard to help support not only our organs, but the baby as well. And then the physical changes that occur to our bodies, just even during pregnancy, our posture changes with the hormones. center of gravity changes. And then if you take also after birth, that's a lot of changes that our body goes through. So when it comes to pelvic health, I always recommend every woman who's given birth, whether if it's a vaginal birth or cesarean birth, to see a pelvic floor physio, because there are different things that we'll see. There are more common symptoms after vaginal birth, like more stress incontinence or heaviness pressure, like a prolapse, versus after a cesarean birth, we might see a little bit more, instead of the stress incontinence, so that leakage with sneezing, we might see more urgency to go to the bathroom. We might see some incisional pain. We might see some core weakness, although we tend to see that with both vaginal and belly birth. Some back pain, but there's a lot of changes that can occur. And I think one of the most surprising one for women after cesarean birth, especially after an emergency cesarean birth, is pain with intercourse. And I think the theory of it is whenever you have any kind of surgery, our body goes into this protection mode, especially in the pelvic floor. So we actually tend to see a lot of tension in the pelvic floor after cesarean birth, and thus that can create some pain and discomfort with intercourse. And then you add in the hormones, which can tend to dry up our tissues a little bit internally as well. But yeah, I think a lot of women do come into it. Either they hear it from a friend that we can do some work for the abdomen, the pelvic floor, the whole body after cesarean birth. It's way more common. I see a lot more clients after vaginal birth. But, you know, cesarean births here in North America, 1 in 3 births are cesarean births. And I think, and I used to do this whenever I'd see a woman prenatally, where they come in and I would talk about everything to expect after vaginal birth. Okay, you might experience this, you might experience that. It wasn't till about like a year after I started doing pelvic health that I was just like, you know what, I've been wrong this past year. I need to start talking about the possibilities of having a cesarean birth, talking about what you can do to help prepare your body for that, but also what kind of things you can do after birth as well. Because the first 6 weeks, it's quite a time where you may not know what you should be doing. You leave the hospital and they tell you, you know, no driving for 6 weeks and no lifting more than the baby for 6 weeks. And a lot of the time,
that being said, people are then fearful, right? Because they're like, I can't drive, I can't lift my baby, so I need to then do nothing. And so I'm really curious as to your thoughts of, you know, is it important that people start moving a little bit after cesarean birth? What does that look like? I know I was talking to one of our prenatal students the other day. She had her baby and she said, I had a cesarean, and when I was leaving, I asked, you know, do I get a wheelchair to leave? And they were like, no, we actually prefer if you're able to walk out. And so she seemed amazed of like, they want me to actually move, because we know movement is really important for a variety of different reasons. So, you know, what are your suggestions for someone in that immediate postpartum, maybe that first 6 weeks before they're, you know, feeling up to get out of the house and to come see you? What should they be doing during that time period to help?
Yeah. So you're entirely right about the moving. Usually they'll try to get women after cesarean birth to start walking within the first 24 hours. And walking doesn't mean like going for like a 2-kilometer walk. It's just about getting up and moving, get the blood flow moving, especially after any kind of surgery. There's always risk of blood clots. So we want to make sure that you can get up and move. You're not just staying in bed all the time. So in the first, and I do like to separate the first 6 weeks into different kinds of exercises and things you can do in terms of recovery. So typically for the first 2 weeks, you know, a lot of it is about pain management. So as a physio, we're not allowed to recommend medication, but I usually suggest, you know, sticking to what the doctor had given so that you can, you know, feel like you can do a little bit more movement without pushing it too far. So pain management is a huge one. Rest, or getting as much rest as you possibly can with a newborn, is important. But yeah, I typically suggest walking, whether if it's like 5 minutes a day, 5 to 15 is usually on average the first 2 weeks, but everyone recovers so differently. So, you know, I always say to your tolerance, just move around. You don't have to go outside and walk like a couple blocks. Sometimes I'm just like, move around the house, just get up as much as you can. Rest, like I said, I always say rest as much as possible, but keep moving. And then just gentle body restoration, range of motion exercises. So oftentimes I'll give some breath work. Probably the most common thing that I get people to start off right off the bat is some nice deep breaths, whether if it's targeted restorative breaths. Sometimes I'll do some abdominal breathing, sometimes some pelvic floor relaxation breathing, sometimes some, just so many different ways. And I'm sure you know a ton of different ways to breathe. So I love the breath work for the first couple weeks to help with just even breathing is a great way to release tissue tension as well. So I love that kind of stuff. And then gentle exercises, like even just laying on your back flat or even just a little blanket underneath your back and just lifting the arms up. That could be a lot of stretch for someone right after cesarean. So oftentimes I'll just get them to lay on their back, put a little cushion, a little pillow, a little blanket underneath, just to restore a little bit of that extension. So that kind of lengthening through the spine, because what we tend to do after cesarean is kind of hover the tension of the scar tissue, and all the tissues that are healing can kind of pull us in. And then you take in, you know, feeding the baby, whether if you're bottle feeding or nursing, holding the baby like this, just some gentle extension exercises is wonderful, not only just for the first 2 weeks, but for a while.
Kind of great movements and exercises over on your Instagram. So we'll make sure that we pop that in the comments below, because I really love how you've broken up over, you know, the first couple of weeks after cesarean birth, third and fourth week, and so forth. So it's a really great visual for people to be able to work through. You mentioned, you've mentioned tension and scar tissue. And so let's talk a little bit about our incisions after they have healed from that cesarean birth. I think people are confused as to what to do. Should they be doing anything with it? And we know it's really important to work and to, you know, break up that scar tissue, because it does have an impact on really our whole body health. So what does that look like? How do you help people move through that process? And for anyone who might be thinking, you know, I'm not ready to touch that area of my body, because it can carry a lot of emotional trauma as well. You know, how do you move people through that process?
Yeah. First off, when you said emotional trauma, that is entirely 100% correct. And I see that quite frequently, especially with emergency cesarean births, where it wasn't planned and it wasn't part of their plan in general for their birthing plan. So usually, and before I usually get people to start doing any like incision work, obviously we need to make sure that those tissues have healed over. So sometimes it can take about 6 weeks for the tissues externally to heal over. So then you can start doing some hands-on stuff. But even before then, I might even get a woman to work abdominally above the scar, even just applying some gentle pressure, not at the scar, but just around it. So they can start doing some like just gentle, maybe even like at the belly button kind of range, just doing some like just gentle pressure. I never suggest poking. I always say use the pads of your hands and just doing some external stuff. It could be skin on skin, but for those who feel disconnected with that area, sometimes I'm even starting them just looking at it, whether if it's through a mirror, looking down if they can, or even just like wearing a t-shirt, or even like depending if they feel comfortable wearing high-waisted leggings, just putting their hands over the incision on top of something else like clothing or even a towel. I don't like towels as much because sometimes they can be really kind of grainy, but if you have a nice soft towel, you can use that. So that's usually where I get people to start with. If I'm seeing them, so if I do, usually I suggest about coming back into clinic at the 6-week mark. Sometimes I might see someone a little bit earlier. So at the 6-week mark, I'm assessing the different layers of the tissue, because I think a lot of people think of just, okay, it's just my skin. Like that's all that I need to work on. When I'm doing massage, I'm just going very gently and just working on the outer layer. But a cesarean birth, when they go through your tissues, it's skin, it's subcutaneous tissue, so adipose tissue, so fatty tissues. They go through fascia, they move our muscles, they move our bladder, and then they get to the uterus. So there are different layers to any kind of release, any scar tissue release. So anytime someone comes in, I always start more external. I always make sure that their skin, everything's healed well, there's no infection. There's no, everything's looking great. I'll start more externally. I might not even start at the incision. So I would say start around it first. see how you feel. A lot of nerves can also take a while to heal as well after cesarean. So that's usually when you get that numbness tingling. So you might not feel comfortable right away. But yeah, so I start more externally. I go through different layers depending on where they are in the recovery. So it's important to know that it's not just skin. We want to go through fascia. We want to make sure everything around that region is moving well. And that includes our organs and just taking pregnancy as well. Baby takes up a lot of that space during pregnancy. So everything kind of gets shifted. So we're not just looking there, but for people who are maybe 4 weeks after recovery and they're like, okay, things are looking great, they can definitely start some touching, some desensitization through their tissues. And then if they don't know what to do, then they can always come see a pelvic physio, and then we can do a lot of abdominal work for them. Oftentimes later down the road, I might even suggest like a Courgeous ball, which is the nice air-filled balls that people can get. I have one right here. I often recommend this later down the road as well. So there's so many different tools people can get as well for some abdominal release, and I'll always teach them in clinic how to use it safely, what to look out for. And I think it's just important to really make sure that, one, tissues have healed, you can start touching. Because sometimes I'll see someone who comes in and they're like maybe 6 months, 8 months after birth, and they haven't even touched anything. And it might be just the fact that they didn't know, or it could also be that they might have some emotional trauma in regards to that area, and they just want to forget about it. And so then we do a lot of work to just bring some, desensitize the tissues and build confidence around it, and even build some core strength. Because if you think of our core, you know, there's a lot of space where the incisions have met, where the muscles had to be moved in order to get to the baby. So those muscles have to rehab as well.
Yeah. And we hear often people say, like, I feel numb. I don't have any feeling in that area of my body. And through these different techniques that you're teaching people, it is possible for them to get feeling back into that part of their body. So it's, they don't necessarily, please, if you're out there and you're watching this, no matter how far postpartum you are, connect with a pelvic health physiotherapist, women's health physiotherapist, who can help you to really understand and to kind of peel away those layers of, how can I reconnect in with myself? Because it can feel, it can feel really degrading as a woman when we feel disconnected from our body, or we feel like our body failed us, or we feel like I don't have feeling in part of my body, or it's painful during intercourse. These things are really, we hear it all the time. They're really, really common, but it's not normal. And there's help out there for all of us to be able to move through this, because I think I can speak for both of us. We want everyone to feel well in their body. We want them to feel healthy from the inside out. And we want you to have the tools so that you are able to feel really good in your body as you journey through motherhood and parenting, because there's so many things that are thrown at us as we mother and as we parent, that we want to feel healthy from the inside out. And so being able to connect with people like you, Sarah, really can make a world of a difference for people. So can you tell people where they can find you?
Yeah, so I work at Bloom Integrative Health and Movement Center. We're on Carling Avenue, next to the big Canadian Tire, if you've seen it. So I'm here full time, and my Instagram is Sarah Trottier PT, and I've been trying to do a lot more awareness on cesarean birth, because I do recognize that it is an area that is a lot of information is missing out there about it, and recovery. So yeah, I think it's important to know everyone's recovery is different. Everyone moves and recovers at different paces, but keep moving. If you're unsure of how to move or what you can do or you can't do, don't hesitate to reach out. I'm there to ask and answer any questions. And, like I said, it's not just about the physical health of how your tissues are healing. It's also about emotional, mental health. So, if you need help, reach out to a mental health professional. I can recommend a ton of wonderful mental health professionals here in Ottawa. And keep moving.
I love it. We just got a comment from Julianne. She says, Sarah's my pelvic physio, and she's awesome. I agree.
That's so funny. Hi, Julian.
It's so wonderful to have yourself and the team at Bloom and so many other health professionals in the Ottawa area and really in Canada now. We're really seeing women's health come more to the forefront. And I think it's important that we continue to advocate for this and advocate for our own health and wellness as well, because we need to take care of ourselves. And if not now, then when? So thank you, Sarah, for being here. I really appreciate it. As always, you have a wealth of knowledge to share, and I love chatting with you. Thank you so much.
Thanks for having me.